The Volcadia Second Zero Foot Drop system features integrated stainless steel electrodes, is easy to use, and requires no consumables. The stimulator consists of 3 buttons. Hold down the power button in the middle to turn the device on or off, and tap the same button to switch between walking mode and training mode. During operation, use the up arrow button to increase the intensity of the electrical stimulation and the down arrow button to decrease it. I will show you how to operate the device and explain the precautions. First, ask the user to sit down, bend and relax the affected leg, and then evenly apply the water-based gel to the skin. Place the stimulator about 2 finger widths away from the knee and align the vertical edge of the stimulator with the tibia. Carefully position the large electrode on the prominent tibialis anterior muscle, and then precisely place the smaller electrodes on the specific area located just below the head of the fibula. This meticulous placement ensures optimal results for the procedure. Adjust dorsiflexion and eversion by precisely positioning the stimulator. If you move it upward or outward, eversion will increase. If you move it downward, dorsiflexion will increase, and if you move it inward, both dorsiflexion and slight eversion will increase. Press and hold the single button to turn on the stimulator. After the stimulator is turned on, tap the power button again to select the training mode. Press the arrow button to set the appropriate intensity and start training. After the stimulator is turned on, tap the power button again to select the gait mode. Press the arrow button to set the appropriate intensity and start walking. While walking, the device controls the movements of the ankle and foot to produce dorsiflexion and eversion by sending electrical impulses to the peroneal nerve as well as to the tibialis anterior and other muscles, so that the patient's leg is lifted in time with each step, ensuring a smooth, natural and safe gait.